mental health conditions, times they can get worse. Today, though, it's World Mental Health Day, and our Healthy Morning contributor, Dr. Jane Morgan, is here with us to talk a little bit more about really just some of the different ways, doctor, to address mental health. We just heard those numbers showing it is so common, but why is there still such a stigma associated with mental health?
And those numbers, Julie, are incredibly large and shocking, really, to a large degree. And we look at what so many people are living with every day, including depression and anxiety. And there are different types of anxiety, but just a generalized anxiety disorder in a world that sometimes can seem upside down. We've just come through 3 years of COVID, speaking of a world being upside down. And there's so much ongoing trauma. And so living with anxiety can be incredibly difficult. And some of the symptoms that you may want to look for in yourself and your partners, of which you may not be aware, are things like a startle response. It's what we call people who are jumpy. You may say you have a jumpy friend. So this startle response to very small differences in your environment. Chronic pain, especially abdominal pain, intestinal pain, diarrhea, and tension that can manifest in the body as shoulder pain, back pain, chronic headaches. So a person who's chronically in pain and in distress, sometimes you can think about it as having anxiety disorders, and then that startle response as well can be related to childhood traumas that are either being masked intentionally or are not being addressed.
Okay, well, let's talk about, I'm a parent myself, and it is disturbing to know I have a preteen and looking ahead down the road that these numbers are very prevalent in teenagers. What are some of the signs parents can look for? Would they be the same, or would there be maybe isolation being a factor, shutting themselves in their bedrooms? What should we look for?
And so when you look at anxiety and depression, you are right. We can have a codependency where the person can be overly dependent on another person, especially for a validation and reaction. That can also then lead to a pattern of disappointment when you're looking for others for your validation. Isolation is absolutely one where a person tends to withdraw inward to their thoughts, and also withdraw from society. And sometimes that can be an indicator sometimes of a rewiring of the brain and of your social situations, but it also can be an indication of trying to understand and make sense of your environment. And when do you need help? Because oftentimes people who have depression and anxiety, it's not only them that's suffering, it's the people in their environment that are suffering.
Well, Dr. Morgan, why is it, given that those numbers are so very high statistically, why is it that not most, but some insurance companies don't cover all mental health services?
That is something that we need to continue to push, because you're right. Oftentimes that is an additional option that you can add, or a rider, and it really shouldn't be that way as we continue to push to make certain that mental health is part of your whole physical wellness and awareness. Something else to think about when we think about diagnosing depression and anxiety. Sometimes people can be overly diagnosed with these symptoms and these conditions and not have them. And women are most at risk, and minority populations. And a subset of the female population, those who are perimenopausal and menopausal, are most vulnerable to be diagnosed with depression and anxiety, when in fact they're having perimenopausal and menopausal symptoms that need to be addressed in a factual way.
So maybe hormonal problems.